This morning we presented our data on a drug called Rociletinib for the TIGER-X trial. We showed our response rate, progression-free survival, and tolerability. This drug is an EGFR inhibitor that's designed to overcome the most common cause of resistance to the first and second generation EGFR inhibitors. That mutation is called T790M. And so a T790M inhibitor is able to get those cancer patients back under disease control. We showed that at the 500 milligram twice a day dose, the dose that we're going forward with for future studies, a response rate of 60% and a disease control rate of 90%. So the waterfall plot was very exciting to see. Patients are able to stay on drug for a significant amount of time. These were highly pretreated patients. 40% of them had a history of brain metastases. Patients were able to stay on treatment for 8 months. If you look at the patients without a history of brain metastases, they stayed on treatment with progression-free 10.3 months. These data show that this drug provides a durable response that was quite significant, I can say, from treating patients. Patients do quite well, being very active, excellent quality of life, playing golf, going hiking, going on vacations. It's been very gratifying to see that. Some of the other data that we reported that was new this year at ASCO was, in addition to the activity in the T790M positive group, we showed about a third of patients that were T790M negative doing well on this drug. It was very exciting, and if that can be confirmed, that would hold up well against the standard therapies now, like chemotherapy. And therefore, this may end up being an exciting option for all patients after a first-line EGFR inhibitor. The other information that we were excited to show was our data on testing not just the tumor for the T790M mutation, but actually doing a plasma test for circulating tumor DNA. You can imagine that a patient much prefers that over a tumor biopsy. We often can get results faster. We were able to show that it gives complementary information to the tissue test, the tumor biopsy test. Some patients that were negative on the biopsy ended up being positive from plasma, and then doing well on treatment. I think that both of those issues may really change the paradigm here. If we can identify patients quickly and get them onto a T790M inhibitor, that may be an important development for our patients to do better.